Hey, Steven.
Hey, Brad.
Let's see if this is working right. Well, I'm certainly shooting a video, and if I'll have to publish it later. I don't know if this is going on live or not. Um, but I'm with Dr. Steven Heinzman, and Steven is a general surgeon, right? Here at St. Vincent's East. He does outpatient surgery at Outpatient Services East. And we're going to talk about hemorrhoids today. I was thinking on the way over here that this should be a topic for Mike Rowe in Dirty Jobs.
You can help retract.
Pardon me?
You can help retract or something.
Yeah.
Like,
So, all right, just to be fair, I had a hemorrhoid recently. So, I don't know, it's very embarrassing.
it is. And for folks that come in, that's the last thing they want to address or talk about or show you when they come to the office.
But I have a feeling that it's incredibly common. I wonder, could you make a career out of hemorrhoids? Could a surgeon make a career out of treating hemorrhoids? You know how they've got clinics that are for like potency. They've got they've got specialty clinics for weight loss. They've got specialty clinics for, hey Bill, you want to join our show?
You run him off.
Can you have a specialty clinic for hemorrhoids?
I bet you could. In a large enough city, you could have a special clinic for hemorrhoids because there are office procedures for hemorrhoids. There's a lot of different types of procedures for hemorrhoids. So in a large enough city with a large enough patient population, you probably could.
So what causes them?
So hemorrhoids are caused because there's no valves in the veins around the human anus, and stasis or blood flow not flowing there can allow that blood to kind of clot, and pressure in that area can cause that tube pressure straining in that area can cause that tissue to protrude over time. You see that a lot of times in folks that are, constipated with their bowel movements. You see it in the lady that's having a baby and pregnant, and she has a lot of pressure in her veins around there and has hemorrhoid issues in the period.
Why are there no valves, and what would valves do?
Valves would help blood return out of those veins a little bit easier than pooling in those veins. And there's no valves because that's the way humans are made.
So you don't have sort of a physiologic answer for why there's no valves in that area. You mentioned something to me about baboons.
Sure. Well, humans walk on their legs. They walk upright, right?
Right.
So other animals don't. They walk on all fours, and they take a lot of the pressure off that very anal area. Right? We stand or sit for long periods of time. They put a lot of pressure on that area.
So standing and sitting increases the pressure, which increases the trauma
Straining.
to those areas. So this tissue for me was just it was to me it felt like just a big blood blister. Like if you ever gotten blood trapped underneath your toe or some other area, just blood just pooling, and it was impossible to get comfortable.
So we want to differentiate hemorrhoids on the inside and hemorrhoids on the outside. Hemorrhoids on the inside you don't have sensation of or feel. It's the very sensitive skin on the outside that's extremely painful to hemorrhoid. And outside or external hemorrhoid with clot in it, extremely painful. Very noticeable because you have a lump. It's very tender and it's very painful. Hemorrhoids on the inside that protrude, you may notice something protruding. It won't have the type of pain that you would have with external.
Okay. So basically, you just popped it like a pimple.
Essentially, just for relief, getting the pressure off that skin was really uncomfortable. Releasing the clot acutely helps with that pain.
See, that's what our viewers need to be able to see. That's why it's a dirty job.
It's a dirty job. But some folks that come in with acute clot, extremely uncomfortable releasing that. Some people come in after a few days, they've tolerated it, and maybe they've sat in some warm water for some relief, and they've kind of softened their clot up a little bit. And over time, they can resolve that. It'll resolve over time if they can get through that initial area, period of discomfort.
Now, over the years, I've had hemorrhoids, but never to the point where I needed it to be lance like a boil. I've had some pressure down there. I've noticed some fullness down there. Are those internal
More
hemorrhoids?
than likely, you're having symptoms from internal illness, and that patients that pressure, fullness, itching in that area, even some protrusion cases, some bleeding or spotting from time to time. They may have that. That's different from what that acute pain from an external being thrombosed and having clot forming.
All right. Are there any more pearls you have for us about hemorrhoids? Or should we leave it there and see what kind of response we get?
If you have a response, that would be great. If you haven't entertained any questions.
Well, why don't we see what we get, and we'll come back and do something more on general surgery at another time as well.
That's great.
Thanks, Stephen.
Thank you.